This is Dr. Lam, founder of drlam.com, and today in this video we're going to talk about something that's so prevalent to most women who are on thyroid medications. And of course this affects the men as well. Now, it is very important to understand that thyroid medication is designed to replace missing thyroid hormone when it is deficient. So if a person is told that the thyroid is not functioning for whatever reason and is put on thyroid medication, they should feel brand new. They should feel fantastic, as a matter of fact. It's just like if you are thirsty and I give you water, you would feel fantastic. However, in reality, thyroid replacement is not as simple. A good percentage of people don't feel better. The question is why? Now, oftentimes you can have multiple problems with, for example, medications not fitting the person, the thyroid not accepting the medications, or there could be other factors that's preventing the thyroid from entering the cells. So there are many, many reasons why this path is not perfectly followed. And conventional medicine, by using a laboratory test, will try to determine where the problem is. Now, endocrinologists are specialists in this field, and there's a combinations of T4 as well as T3, and also T4, T3 combinations, whether in synthetic form or natural forms, that can be used to help the body get more thyroid. Now, it's very important to take a step back and ask yourself, do you really have a thyroid problem that requires thyroid medication? And if so, if thyroid medications, after a certain time of adjustment, is still not helping you, you're still reporting dry skin, low body temperature, fatigue, etc., well, the question is why? Could it be that the thyroid medication is really not what the body wants? I ask this question because so many of you come to me have the same problem. In fact, thyroid adjustment is very challenging because it is different for everybody. Now, if conventional medicine has exhausted its ways, I think one of the things you have to think about is, could it be that it is not what the body wants? In a time of adrenal fatigue, one of the things we notice is that the body starts to slow down. And in that process, thyroid function is going to be slowed down as well. So when that continues over time, then the thyroid laboratory test will be abnormal. So without factoring the adrenal connection, many conventional doctors, based on symptoms alone, will then start medical thyroid replacement. Sometimes it is done as a trial for symptoms control, and that's okay. But if that indeed is the problem, meaning you really have a thyroid problem, whether it's Hashimoto's or other autoimmune problem, then the rapid recovery is to be expected. If after a while people are not getting better, then you have to ask whether the problem is indeed in the thyroid, as I said earlier, or could it be in the adrenals? We've noticed that a lot of people with adrenals problems end up with thyroid problems, and then the thyroid is taken as low thyroid function, given thyroid medication, and they don't get better. On the other hand, the same people, if you support them with a bit of adrenal fortification, their thyroid functions improve, and in fact, the thyroid medication need will go down. And oftentimes the doctors are pleasantly surprised and not really know what is going on because they themselves are not in tune with the adrenals, while the patients embark on their own adrenal support program and help the thyroid at the meantime. Now, one of the dangers, and this is not something you want to do, is that self-navigation for thyroid is very dangerous because you can do the wrong things at the wrong time. So always go back and check with your doctor. But with the permission of your doctor and a good thyroid program that is being monitored, and then you embark on an adrenal support concurrently Oftentimes, you can have the best of both worlds, meaning you can help the adrenals, and when you help the adrenals, you can help the thyroid concurrently. So understanding why the body's having problem resisting thyroid replacement is a key and important concept to know, and it is an important symptom to recognize in adrenal fatigue. Those of you who have this problem, I would encourage you to go to my website, drlam.com, and read a very important article called Hypothyroidism versus Adrenal Fatigue Syndrome. Because in this article, I will go through with you the differences so you can clearly understand which track you are on so you don't get misled by the symptoms and get confused. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I have written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.